people who appear like they're loving and supporting you.
Mm.
And one of the ways
Hey players, welcome back to the Slaying Self Doubt YouTube channel. Here is where we empower Black women to overcome their doubts, fears, and insecurities in order to walk into their God given purpose. How do we do that, you ask? Well, we create safe and brave spaces just like this for Black women to show up authentically as themselves. So join me and sometimes some of my friends or our journey as we remind you that you are not alone. I am Coach Felicia, and together we will find our fears and slay them. Welcome back to another episode of the Slaying Self Doubt Podcast. I am here with a Dr. Tiffany Smith from Las Vegas, y'all. Listen, living, what they say, living in Las, that's not what they say. That is
live
not
a la
the,
vida
but
loca.
right, I know, right? But oh,
Something.
it's really what happens in Vegas stays in Vegas. That's
That's right.
the that's the quote that we use. She is the founder and practitioner of Aroma Functional Nutrition Psychiatry. Did I say that right?
You said it right.
Yes, I said it right. Well, thank you so much for joining us, y'all. This is going to be, I always say that for me, whenever I'm talking to someone who deals in health and wellness, because it's a big thing for me, I'm definitely an advocate for it. Mental health. And y'all know Jesus in therapy. And my background is in healthcare. I always love these conversations because it's a conjoining of what I do now and what I did before. So it's always a great thing. So, Dr. Tiffany, can you please introduce yourself to the people and tell us a little bit of how you got started?
Sure. So I'm Dr. Tiffany M. Smith, originally born and raised in St. Louis, Missouri, now reside in Las Vegas. I am an integrative and functional psychiatric nurse practitioner. So that's a mouthful. And what it means is that I don't lead with medication in my practice. I assess, diagnose, and treat mental illness.
Mm,
Just like you have a psychiatrist who is an MD, I am a nurse practitioner form,
yeah.
of that. So so anywho, St. Louis, Missouri to Las Vegas, assess and diagnose, but I do not go med first. I get to the
Okay.
root cause of our
Mm,
mental health issues. And sometimes no medication is even needed.
yeah.
And so I utilize lifestyle medicine, functional medicine, understanding dysfunction in the body, things in our lives that affect our mental health, because mental health is everything
Yep.
and everything is mental health.
Yeah.
And so I take the holistic approach in treating and managing clients. And it's not just that stressor that's
Mm-hmm.
going on in your life, that thing that's stressing you out,
Yeah.
but and it goes into your eating, sleeping, activity, and people you're with, but also what does your environment look like?
Mm,
Is it loving and welcoming, or does
yeah.
it stress you out too?
Right. Right.
Things like that. So
Yeah, first of all, I love that it's holistic because I do feel like that we all are starting to, well, I ain't gonna say we all, but lots of people are starting to go into that direction, right? Because they recognize that even the medications, not to say that they're not helpful, but sometimes they have side effects that make whatever it is you're going through worse, right? And I think something that you said is that sometimes medication is not necessary.
right.
It's oftentimes the easiest thing, the quick fix, right? Because doing the
Hmm.
holistic approach requires you to make some sacrifices. It requires you to remove some things, people, all that stuff. Y'all, we gonna get
Yeah.
into it. This is why I say I already got the goosebumps. I already know, okay? Because it makes you make a change, and most people
Correct.
are not willing to change their life. They just want to quiet it, right? Like, let me just deal
Right.
with what it is that is going on versus being like, now, if I move from Missouri to Vegas, I might be in a better situation, right? Or if I move from DC to, I don't know,
Hmm.
LA, it may be better for me. Like sometimes it is, we have to make some changes, and medication isn't necessarily always the first approach. So I love that you
Right.
are going into that direction. So how did you even get into this space?
It's because of my husband. The love of my life was struggling, and our current healthcare system wasn't meeting us where we needed to be. So,
Mm-hmm.
in our healthcare system, it's about acute care. It's
Right.
about, you break your arm, let's fix it.
Mm-hmm.
But when you're dealing with something like chronic pain and whatnot, the things that they give us can be too much.
Yep.
So, yeah, you could get out of pain, but you might be sleeping all day. You might
Right.
feel
Yep.
hungover.
Mm-hmm.
The options may be invasive.
Mm-hmm.
And so those were the options that were available to my husband. And he said, forget all of this because it ain't making my life no better,
Right.
And so he is a combat veteran and was trained in the military as a nurse. I'm also in my nursing arena and coming into being a nurse practitioner.
Mm-hmm.
All we knew was what the healthcare system offered.
Yeah.
So now he's saying none of it. So it's like, well, what are we going to do? Because this is all we know.
Right.
And so that was a journey in and of itself. Having to be open to the universe, open to what our research and what we find and what we feel might be the best thing for us.
Mm.
And so in that, the first thing we found was aromatherapy. And so my husband was skeptical. He's
Yeah.
like, how's this little oil you gonna rub on me be better than some Percocet, some
Yeah.
injection, or whatever our healthcare system says you should do
Mm-hmm.
for this? And lo and behold, it worked. But I had to go to school and get a degree to know how to utilize those oils because Dr. Google didn't tell me,
Really?
and people, yeah, people around it. So it's hard. You want to always find the authority sources and resources
Mm.
that's backed by research so
Yeah.
that you know you're doing the right thing.
Yeah.
And as we know, there's a lot of misinformation on the internet. So I got the advanced education, and in that, you have to do case studies. You have to create blends for different conditions and give them to a patient and try them out. And so that was my husband. And so
He was the
we
guinea
found
pig.
he was the guinea pig. So we have different oils, created different oils for different things, for muscle fatigue, for neural pain, for bone pain.
Mm.
And then just mental health and well-being. What's going to help you feel better, help you just kind of, some of those, sometimes you get into things, you can smell something and just get you going and you
Yeah.
hype and you're ready,
Yeah.
like when you listen
Yes.
to your song. Oils can help you do that too. But I needed to understand that no one was discussing contraindications to
Mm.
using essential oils. So if an essential oil, for example, helps you lower your blood pressure,
Yeah.
and maybe you already have low blood pressure, it's contraindicated, right? But
Right.
nobody says that. They say,
Yeah.
buy my oil, buy my
Right.
oil. So
Exactly.
those were the things that were important. We knew they were important because coming from our medical background, everything has to be regulated because you can do
Mm-hmm.
too much, too little. And so what's the middle ground? So that was the first thing. So then he's starting to get up and back engaging in our lives.
Mm.
So we're raising kids and living life. And so he's slowly was fading into the background because the pain was so debilitating
Mm.
that now we're not going grocery shopping,
Yeah.
going to the kids' functions together, and that sort of thing. And so we had to reclaim our life. So aromatherapy was the first thing that helped us do that. He was out of the bed, feeling pain free, and we were working through that. So how can we prevent that? So that's
Yeah.
where we learned more about that root cause medicine, and I got advanced training in functional medicine and lifestyle medicine. And we
Mm.
start targeting our lifestyle and everything that we're doing that could be exacerbating any
Mm.
conditions. and
Wow.
and then that was what really helped pull it all together. So we named the company Aroma Functional Nutrition Psychiatry because those are the foundations.
I just got it. What she said now I know. I tell the story like, oh, it's the aromatherapy and the functional. I got it. Okay.
Yeah. And so that serves as a symbol to say something's different there,
Yeah.
right?
Yeah.
And so while that was our trifecta in our journey,
Mm-hmm.
it's also offering and saying that we all have our trifectas and things that we need to help us be the best we can be. And maybe it's massage therapy, hiking, family time,
Yeah.
all of these other things. But we have those things, and you need a practitioner that's going to listen and understand you to help you have the treatment plan that works for you, not
Yeah.
what I want you to have,
Right.
but what will benefit you the most. So
Yeah.
that's kind of how it all came about, was through my journey with him. And now, we're living life to the fullest. He does 20,000 steps a day.
I know that's
Um,
right.
all right. So he is just awesome sauce, living his life, and we're living it together. So we've reclaimed our life, and every day it's a journey,
Yeah.
but we have the tools in our toolkit to move forward. And so that's what I wanted. What I found was that after doing all of that with him in my traditional practice, I saw parallels in my clients and that they could
Mm,
benefit from all of this that we did in our lives.
yeah.
And that's where we created Aroma Functional Nutrition Psychiatry to give that empowerment and that help people reclaim
Yeah.
their lives, because it's all within our grasp, but
Yeah.
we don't always see it when we just look outside ourselves. I like to help people look inside themselves and
Yep.
find the answers.
Yep. No, that is so good because like I was saying, like the easiest thing to do is to say, oh, take this pill, right? In
Right.
any health condition. Now, there may be certain situations where you absolutely have to take medication. I'm a firm
Correct.
believer that there's some things that if you want to prevent, I've shared on here oftentimes, within the last 2 years, my family history and cholesterol is ridiculous. And,
Mhm.
I've tried everything I could. And my cardiologist was like, let me just tell you this. I am trying to prevent you from having a cardiac event. Right. And it was just
Mhm.
like, I want you to keep doing what you're doing, but your numbers are never going to go down. Like, it's your genetics, it's in your system. I'm going to need you to do all the exercise and pay attention to all of that stuff. Maybe we can reduce the numbers, but where I started, I can say from where I started the medication I was on to where I am now, my lifestyle change has changed that. But I also
Mhm.
know that my grandfather had triple bypass surgery. Like everybody on both sides of my family, we just
Mhm.
ain't they wasn't eating right, doing right, all that stuff. So it's like
Right.
I do know that those things are a part of it, but there's some adjust. So it for me, it's like I'm okay, even though I don't want to. I'm okay with taking it because I'd rather not have a cardiac event. So
Exactly. Everything, exactly. Everything has its place. And I
yes.
think in our society, we're putting so much emphasis on medication that we're
Mm-hmm.
losing ourselves and what we can do, because your providers are taught the medications and procedures, not how to prevent them,
Yes. Yes.
and how to maximize your life. They'll tell you low salt diet, low fat
Mm-hmm.
diet, but it's just that. It ends
Right.
there. You
Yeah.
got to figure the rest
You gotta
out.
like yes, you gotta figure the rest
Exactly.
out. And I was gonna say, even with aromatherapy, I was never into stuff like that. One, because I have allergies, so like anything that smells a certain type of way, I'm gonna immediately sneeze and all that stuff. But during, the panorama, my family had COVID, and before I had it before, like when it first came out, but nobody knew what it was. It was just that real bad cold
Hmm.
everybody had. But I
Right.
remember I always tell the same story. I remember a distinct day that I was like, I do not feel right. I've had asthma and allergies my entire life, and whatever is going on, this medicine that these people then gave me, again, being in healthcare, the lady gave me some. I was like, man, you take 4 of these, it get rid of anthrax. Like, what are you giving me? Like, I know enough to know that why am I taking this? But I'm like, okay, I want to feel better, and you want it quickly, right?
Right.
And so I
Right.
took it, but then it made me worse. And I was just like, Lord, I'm gonna stop all this medicine, and all I'm gonna do, treat my symptoms, take care of myself. I just did water, made my own soup, like I did all these different things. But one of the things I was trying to get rid of the fever part. So by that time you were sitting in the bed, you ain't got nothing to do but Google, right? So I had
Right.
like this peppermint oil for a diffuser that I
Hmm.
couldn't use because it was triggering my asthma. But it said if you put it on the washcloth, it helps with headaches and fever. And so I was like, well, I'm gonna
Yep.
see. Sure enough, I did it on everybody in here, and within like 24 hours, everybody's fever had. And I was just like, now if that ain't nothing, right? It's just some water. It's a couple of drops. And so, like you said, it like until you know what is, we have
Right.
to do the research. You have to have the people to be able to tell you what to do. Cause I
Hmm.
felt so bad just taking all of this medicine. Like it was like
Right.
I don't what's going to happen to me after these 7 to 10 days that I'm taking all this medication? What is
Right.
the long-term effects of it on my body? Because I'm just trying to reduce a fever versus like trying a natural way to say, let me space out this medication to try to fix. And so now I've gotten to the point where I'm like, all right, maybe I just need to drink some water. Maybe that's the reason why there's some
Exactly.
things that's going on. And so I'll try all the things first before I go and
Yes.
immediately to medication. And so, but like you said, learning that and having to go through
Yes.
trial and error, be like, yeah, well, that don't work for me. Okay, I'm not using
Hmm.
whatever y'all using. That's not working for me. Like zinc. I know that's a thing, but it make my stomach hurt. And so I'm like, I can't take it. So it's just not an option. So I want to know, like, during this journey and, the going through this stuff with your husband and transitioning your practice and all of that, how has self-doubt showed up in your journey?
Oh, every step of the way, and I think that one thing I realized was that the self-doubt piece isn't always something we bring ourselves. It
Mm,
comes down from generation.
mm,
Um, it's
preach.
it ain't always just oh, I have self-doubt,
Mm-hmm.
but when you get those microaggressions and you hear see certain behaviors from your parents, and me coming up, you had to be certified, bona fide, and qualified, to step out
Hmm.
in the world. We got to always come, correct in everything that we do,
Yes.
when our counterparts can wear wrinkled shirts and hair messed up and flip-flops. And
Mm-hmm.
so all of these things cater to self-doubt. I mean,
Yeah.
people do things and don't have certifications, and we feel like we have to have every certification and a PhD, and all of that generational trauma and
Mm-hmm.
generational lessons that have come down. It affects our self-doubt.
Yeah.
So it's not just like it's me, I got a problem. It's our society, what we are in, our environment, that can create that self-doubt. So I want to take the burden and pressure off of people that are like, it's me,
Yeah. No,
I'm
that's
wrong,
good. Yeah.
I'm the problem. No, 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 no. You are receiving a lot of things that are challenging you and who you are.
Mm-hmm.
And so it's not you. You're doing the best you can in your situation. And so
Yeah.
know that you are all right. And I'm
Mm.
speaking to the listeners. You're
Yes. Hey, you talking to me too? Okay, that was
okay.
a word right there, because I don't think that we necessarily recognize that that is something that we're battling on a every
Yes.
day, every moment. Anytime you try to start something new or do something, we are trying to
Hmm.
qualify ourselves, and we're
Hmm.
basing it off of what we are assume someone else is going to say. Oh no, you're not qualified to do that because you don't have X, Y,
Right.
and Z. And that is rough. Okay, now that I'm thinking about it, like that is rough that we don't even take chances on ourselves because we like, I don't have. You hear
Right.
oftentimes people talk about when specifically as women, when we go to apply for jobs, we look at
Hmm.
what the requirements are or the recommendations are, and we be like, oh, I don't have that, I don't have that, I don't have that. So I'm not even
Hmm.
going to apply for it when 9 times out of 10 they're gonna end up putting somebody in there unqualified anyway. Then you probably know more than they do.
Right. And you know what I take from that? I have a you have to tell me no attitude.
I know that's right.
Um,
Yeah,
so I'm not gonna assume anything. I'm not gonna not apply for that job because I don't have one or two of the things. Tell me no, you
yeah,
know.
yeah,
So that's one of the things that I want to emphasize with your listeners and yourself is let them tell you no. Don't
yeah.
assume you've already lost or you're going to be rejected or you can't have. One of my biggest oh, I don't know what the word is for this mantra, saying, affirmation thing I live by,
Mm-hmm.
is that from the Bible, John 10:10. I've been saying Philippians for a minute, but it's John 10:10 that says that we should live life and live life more abundantly.
Yeah.
And so I learned that like early in my adulthood, and I take that in everything that I do, you
Mm.
know. So tell me no, because my blessings can be anywhere,
Amen.
I don't know. So I gotta overturn every rock, everything, and
Yes.
be present,
Yeah.
you know. And while yes, I can be like, oh, I don't know, I'm nervous, like I might put the application in
Mm-hmm.
and I'm like, oh God, I hope they call. It's been 24 hours. I
Yeah.
still have all of that, but I'm not gonna not do the action.
Yeah. That is
So,
ooh. Mm. Okay.
so
Let me just tell y'all, y'all already know, y'all be knowing when stuff be happening. So first of all, this is confirmation because I've been reading Live Your Best Life Now by Joel Osteen. And so I've been reading a chapter a night. And the chapter I just read was literally about this conversation. Like, be expectant of good things to happen. Don't count yourself out before you even get started,
right.
but you need to live a life of expectancy that like something good is going to come from it, that this is possible. I can have it. I can do, like, you're living that way. You're going to get more things coming for you and blessing you than you will
Right.
saying, this ain't gonna happen. I got bad luck. This always happened to me.
Mhm.
The negative self-talk and the negative just
Right.
rhetoric that we do, it just brings negative stuff. So then, of course, when something bad happens, then you like say, I knew it was going to happen, versus what could you be receiving by changing that around? So you saying that was just confirmation for me. So thank you. This don't have nothing to do with the rest of y'all. That was for me. Um, so what have you learned about yourself during this journey that you didn't know before?
I didn't realize a lot of how my past and cultural things, our generational traumas and stuff have affected me. I'm always, like I said, I'm going for it. I'm self-motivated. I'm
Mm-hmm.
doing all of this. But I found that that is where a lot of the self-doubt comes from. Some of those
Ooh.
things in the past,
Mm-hmm.
in the environment, um, and I didn't realize them until, because and it's interesting. I look at when I was 22. I'm this fireball, right? I'm a young adult. I can do anything I want to. I can stay up all night. I can go eat out. I can do this. I can do
Right, right,
that.
right.
So I'm embracing all of that. So I'm fearless. So now that as I'm getting older, it's like, why do I feel like I have more fears? I have more to
Mm,
lose now.
mm.
And so now I'm second guessing stuff. And so I gotta revert back to 22-year-old Tiffany,
Yes.
and where was that power and that spark and that fearlessness? Because so what do you do with that? So then the thing is, well, what do you do with that? Well, you make sure you have your protection in place. You have an emergency savings fund. You have
Mm-hmm.
life insurance. You have all of the things that protect those things that you are concerned about.
Yeah.
Advanced education, da da da. So I go forward into the fear and figure out how to address it and not avoid it.
Mm,
So with self-doubt, though, let's go back to self-doubt. That's where you need the community.
mm-hmm.
Sometimes you need people to remind you of who you are.
Ooh.
you know,
Yeah,
and
whenever people say that, it reminds me of the scene in Black Panther where Felicia Rashad is yelling at Chadwick Boseman. She's like, show him who you are. And I'm like, yeah, show him who you are.
right, and we need to know that for ourselves.
Yeah.
We should have that image. Now you should put that image is in all of your listeners' mind.
Yes.
That
Yes.
should be a meme you put out on social media because yes, it's hard for us to see that we're like awesome sauce in this one thing.
Mm-hmm.
So
Mm-hmm.
maybe we're going for this thing and we are awesome sauce at it, but we don't see it. It comes
Yeah.
easy to us. It's just
Yes.
what we do. But when somebody says you said the answer, you got the power,
Yeah.
this is your jam,
Yeah.
it's like you get amnesia that you
What
you
did
know,
I do? Tell me what I
right.
did. Right.
What I just say, right? So community is everything. Make
Yeah.
sure that the people around you are those that are truly loving you and supporting you. Um, and so you got to watch for people who appear like they're loving and supporting you.
Mm.
And one of the ways you'll know that is they can make some snide remarks as a joke. See, I don't
They
play,
not joking. Okay. That
right?
that
Right?
read
You
between the
want
lines. Okay.
Right. So you want those that really love you, really going to tell you about you and how you are and what you're doing, so that because you're going to be blind, that's that blind side
Yeah.
of who you
Yeah.
are. So that's going to help with self-doubt a lot.
Yeah.
When someone says, you know what, you are awesome sauce, you are the jam, you are the
Yeah.
best. Let me tell you why. And they
Yeah.
break it down and you be like, well, I'm going to reject that thought from now on. And that's
Mm-hmm.
how what's the next step is you reject when those thoughts come because you've received facts about who
Mm.
you are,
Mm-hmm.
you
Yes,
know.
I love that because that is one of the things that I tell my listeners, my clients, is to keep a a wins log, right? I'm calling it something else, but
Hmm.
in my mind, I'm because I'm trying to say two things at the same time. But you need to keep a
Hmm.
track record of your wins. That's what I was trying to say,
Yes.
right? So I have it. Oftentimes we get to the end of the year, and specifically in this entrepreneurship journey, right? I don't think
Hmm.
I've ever felt this any other time of my life except for when the Lord said, "Come on over here and play in this area, right? Before I could see the fruit of my labor. I could see when I'm working in healthcare, you see the patients,
Right.
sometimes you get immediate gratification, right? You're able to see that thing
Yes. Yes.
the patient transform or be grateful for your kindness or whatever it is that you, so being in that
Yes.
space was kind of like, oh, okay, I know what I know my value, you know what I'm saying? I know what I bring
Right.
to this space. But over here, over in this area,
Crickets.
you be like, so don't nobody see me? Like, y'all just gonna keep walking past. He gonna keep walking past me. And so I had to be intentional. It's like 2 years in a row. I was just like, I didn't do anything. Like nothing, I accomplished nothing this year, right? And
Okay.
again, like you said, the people in your circle, somebody else having to say, girl, do you not see what you did here? Did you not? And I'm like, oh, yeah, I guess I did that. And it's kind of
Yep.
like we minimize it, right? Because what we're
Yes.
expecting is all the way up here, we
Right.
can't even see. But what is happening, there's still forward movement. And so
Yes.
I just had last year, actually, I started because, I had this conversation multiple times with my therapist, and she was like, if you don't, I need you to, one of my assignments was sit down and I want you to is go through your calendar just based off
Mm-hmm.
of what you did in your calendar. I want you to write down every single thing that you did, whether it be family, within your marriage, in your business, work, whatever the case may be. I want you to write it down. All of those are wins, right? And so
Mm-hmm.
by the time I got to the end of, I said, okay, girl, I see you out here doing stuff. And so I started the new year and I did the same thing. I just was like, okay, we're in October now, so I probably need to go through my calendar and go through the summer and say, what did you accomplish? Some of it is just a goal that you set for yourself,
Yeah.
right? Maybe you did start walking every day. I ain't at
Right.
20,000 steps like your husband, but I definitely hit 10 for the first time in like years
See?
yesterday. Okay. And
Yes.
so I'm like, okay, well, now I'm paying attention. So now I need to walk a little bit more. I feel better
Exactly.
because I think the other part is that knowing these milestones or these goals that you're hitting and seeing your track record encourages you to do more, right?
Yes.
And that
Yes.
momentum pushes you to be like, okay, I need to show up because I remember how I feel when I'm showing up and I'm showing you who I am. I'm like, you see this? So even if it's crickets and nobody is buying
Mm-hmm.
anything or wanting to use your services or those things, I still have this thing to say, like, well, maybe this time is for me. Maybe I need to prepare for whatever's coming versus being like, oh, where before, I would be like,
Mm-hmm.
I'm just forget it, Lord. I don't even know why you sent me over. Why you even sent me over here to do this? It's a different feeling now. So I definitely agree with that. So I want to talk about, speaking of entrepreneurship, what it means. So you in what you do in your practice. Well, before we get to this question, the question that I have is for those that are in the Vegas area, right? If they were come to your practice, can you explain like what their process would look like for them, for those who would be like, I want to try a different approach. I'm tired of taking medicine. Like, let
Yeah.
me get rid of some of these people that's around me.
All right. Well, I'm licensed not only in Nevada, but Arizona and the Washington state.
Okay, yeah. See,
So those
West
areas as
Coast,
well.
West Coast stand up. Okay.
So I have a framework that I use. It's AFNP, which is the acronyms to the company.
Keep it all together. Keep it in alignment. Keep it in
Yep.
alignment.
And the A stands for aspire. The first thing I want to know is what's important to you.
Mm,
Why are you wanting to make changes and why now? What do you want your
yeah.
life to look like in the future? Because that's going to help keep that motivation because, like you said, change is involved.
Yes.
It's not, you don't just take the pill. So, what is your motivation? What is driving you? What are you trying to get, do, or be? So that we can make sure we stay in alignment with that and we stay focused.
Yeah.
Um, so then the F is fortify. And this is where we get into your lifestyle, your physiology, everything about you,
Mm-hmm.
and we level that up. We
Mm.
optimize you so that you are the best you can be. So I have a wellness program that'll give you the lifestyle foundation as far as your nutrition and exercise and I utilize specialty testing and stuff, so I really get
Mm.
down to what's going
And
on
she
at
getting
the
all up in your
cellular
business,
level,
y'all.
all up in it. I'm talking about the genetics and everything. I know what your grandpappy is and mom is and everybody. I can get into that. because it matters. And even if you were bottle fed or breastfed, it all matters to who you
Yeah.
are today.
Yeah.
So we strengthen and fortify all of that, giving you all the resources, start making the transitions in your life to help you make the transformation that you want.
Mm-hmm.
And then the end is to nourish and nurture, and that's giving you
Mm-hmm.
support, giving you mentorship, giving you guidance.
Yeah.
And then P is prosper, helping you now take everything that you've done, all of this transformation you made, and helping you to independently implement it in your life. So, unlike maybe other psychiatrists, it's not years that
Yeah.
we need to spend together, going through this or doing that. I'm going to give you a bunch of tools, resources, lifestyle habits, everything you need, mindset shifts, all of that.
Yeah.
And then you're going to transition. And all you'll need is just some connection points,
Mm-hmm. Mm-hmm.
and every now and then some perspective shifts when
Yeah.
life happens. But you've done the foundation and the groundwork.
Yeah.
So, um, I do a discovery call. We talk, we figure out where you are, and then we can put you in the places that you need to be that works for you. Everything
Yeah.
is customizable to the individual.
I just the framework was inspiring. Okay, like I was like, because it's very intentional, right? It's
Hmm.
very intentional to move you forward, right? And I
Yeah.
think that sometimes what um I always say the stigma that goes around, unfortunately, still with therapy, we're getting a lot better.
We
But
are.
with the mental health and therapy is just that, oh, they just want to be all up in my business or this, that, and the third. I want to, but it's like, it, being as though the very first thing is like, what do you aspire to be? Like, this don't have nothing to do with me, but where are you trying to go? Right. Because
That's right.
if you know you're trying to go somewhere, my job is to help you get to that place. Now,
Exactly.
it may be to have to figure out what happened back here, but my goal is still to get you to move forward. And I think that
Right.
sometimes we don't recognize that we need help in that area because oftentimes our community, if you don't recognize that you don't have the right community, they are intentional about keeping you exactly where they are because it's easier for them, right? And
Mhm.
so I've said this on here more than one time that some people don't want you to grow because they're comfortable because of where they are. They don't want you to outgrow them. They'll be by
Yeah.
themselves. They'll be lonely. Go ahead.
The
I can tell
question.
you was right.
You changed.
Oh, yes, you and now you acting different. I always be like, if someone says I didn't change, I really need to look at myself. As long as it's
Right.
not like for a negative reason, like what part of me changed? Oh, I want better for myself. Oh, okay
Right.
then. Like,
Yeah.
am I mindful about certain things? Like we have to grow. Like
Right.
just like a plant. If you ain't growing, you dying. I don't
That's right.
that's it.
Which
So
one? Which one
which
is it? For me, it's health or sickness, where you want to be.
absolutely.
Yep.
The choice is yours. There ain't nobody's
Yes.
forcing you to do anything, but you have to make a choice. I was telling another friend of mine just about something else, and it was about applying for a job, and she's like, yeah, all this other stuff. And I said, well, listen here, we're not gonna keep having this conversation. It's one of two things: either you're going to apply for the job and you're going to try to figure it out and see what's going to happen, or you're saying, I'm comfortable staying where I am. And if you're comfortable
Right.
staying where you are, don't keep calling me to complain about it because
Right.
I'm gonna just keep telling you, you just go that way, go that way. But if you just
Right.
want to stay here, that's your business. Then be comfortable
Hmm.
with where you are, and that's okay. I ain't gonna love you no different, no less. But
Right.
you make the choice to stay where you are. I don't
Hmm.
want to talk to you no more. Okay, fine. Call me back later. But it's like if you're my friend, I want the best for you. I want
Right.
better for you. So if you're a part of my community, everybody already know I'm gonna push you, especially since God has given me this. There's no
Hmm.
way you're gonna be talking to me talking, I don't think I can. And I'll be like, okay, then you know what you just activated, right? I'm about to go all the way in. So earlier, as I was talking about this journey, in entrepreneurship, and you both was like,
Hmm.
we was in agreement.
Hmm.
Sometimes in entrepreneurship, it can definitely weigh you down. Okay. It really
Hmm.
can be worrisome because of the inconsistency. People have to be willing to
Hmm.
invest in you. And I shared this on here that I started therapy once I transitioned to entrepreneurship because I felt, even though I knew it was a God move and he told me to leave, I was so nervous and so like, what about my family? What about this? Like, how, because we don't recognize the value that we place on having a consistent full-time job, that
Correct.
you be like, oh, what do I offer? Like the things that I said 4 years ago, like, what do I offer my family? And to know now what has transpired in this 4 years that is irreplaceable, that had I been at that job, things that did happen
Right.
would have never happened, and the impact of that, like, I just be like, this is where the Lord got me. So I'm chilling right here, right? But I want to talk
Yeah.
about the mental health wellness for entrepreneurs and what they need to be
Hmm.
doing to stay grounded and just stick it out, child, until
Yeah.
till we get a win. Okay.
Yes. And it is so true. Entrepreneurs have an increase over the more of an increase over the general population for mental health conditions
Mm,
than anyone else.
I
You
believe it.
know, the isolation and all of that is there. So one of the number one thing is we got to take care of ourselves. I mean, I don't care if it's entrepreneurship, motherhood, parenting, being a spouse, you always have to come first. Wherever you are in life, it's
Mm,
about you being first. And now you hear that all the time, right? So you hear it and you just be like, yeah, yeah, yeah.
yeah,
You
I
know,
hear you.
self-care, self-love, I hear you. But this is what I want you to do. I want you to look at your calendar. And you need to have three things in business. You need to work in your business, doing that thing that you do. And then the other part is you need to work on your business, preparing and, researching and all of that. But then you need to be away from your business.
Mm,
Okay.
okay, I'm about to write this down. In your business,
It's like,
okay, on your
remember,
business and away from your business.
yeah, remember when you had a jump rope on the ground, the two
Mm-hmm.
jump ropes, and you jump in, jump out, jump side to side, jump in,
Yeah.
jump out, jump on.
Oh,
That's
yes.
your business. That's your business.
Wow.
In your business, outside of your business. Side to side is the flexibility you need to have in your schedule and in your
Mm,
life,
mm-hmm.
but in, out, on, and sometimes you shift that left to right. So
Yeah, I love
that's the
that.
analogy of you and your business. So look at your schedule. When are you working in your business? When are you working on your business? And when are you away from your business? And then drill it down to the away to when are you away for you? Because you can
Mm,
be away to take the kids. You can be
mm-hmm.
away
Mm-hmm.
to go grocery shopping and to do
Mm-hmm.
this and to do that. But when are you away in your business for yourself?
Yeah.
So look at your calendar and see, are you on it?
Yeah, that's probably not. Probably, I mean, listen, even I mean, you definitely so for some people, I've talked to some people who are very, very good about putting themselves first, right? And
Okay.
there is going to be some people that, even like myself, like before even before entrepreneurship, like you said, no matter what you were doing, when my kids were younger, baby, there was no room for me, right? Because it felt
Right.
like I needed to be everywhere. And,
Right.
my husband would probably say something, roll his eyes, but mom guilt
Hmm.
is real, right?
Hmm.
And you feeling like, oh, I can't go do this or I can't go do that. Some of that has to do with control because we want it
Hmm.
done the way we want it done. And that's the reason why we won't let them do what but that's a whole different
Right.
podcast, right? So we're gonna leave that over there, right? But I
Yeah.
think like for me, I feel a little bit more comfortable because my kids are older. I got teenagers now, right? Now
Hmm.
they want food with me when they want to, right? But now I could be like, no, mommy's gonna go do this. Like I have to do this for myself, and even
Right.
for my husband, like I need my love tank filled. That's what my pastor calls it, like filling your love
Uh-huh.
tank, right? I need
Uh-huh.
my love tank filled, and that looks like different things. It could look like getting a pedicure. It could look like going out with my girlfriends. It could look like
Right.
going to get a massage. It could look like sitting in the bed and watching five
Hmm.
seasons of New Amsterdam. Okay.
Okay. Okay.
It can
Yes.
look like, but it's what I need for myself is like
Exactly.
that's what you're saying with your away part. But a lot of times
Hmm.
I think that depending on what your life looks like. So I guess that what my question would be like, how do we manage that when your life is going like this, right? When it's
Yep.
fluctuating and you feel like what's a healthy amount of me time, right? Like everybody can't do
Okay.
weekly, bi-weekly,
Mm-hmm.
a month, quarter, like
But you can
annually?
do 2 minutes, 3 minutes, you know,
Oh,
you grab that time anywhere you can, you know, so okay. So as a nurse, the nurse is running back and forth. They so
mm-hmm,
busy. They ain't got
mm-hmm,
time to take a lunch break or
right.
nothing. But there's one thing that you have to absolutely stop what you're doing to do.
Use the
And
bathroom?
that's pee.
Yeah.
So you want to give yourself time, that same type of urgency.
Oh,
Without you, there is none of that other stuff you got to
yes,
do.
yes,
All that
ma'am. Mm.
fluctuation, it don't happen without you. So
Yeah.
you have to treat it like a pee break. Every stop, we canceling that because
Mm-hmm,
I
mm-hmm,
need to do this. So, like you say, well, when do I know I'm this and that? Well, when do you feel good or refreshed or
mm,
replenished?
mm-hmm.
That's when, you know.
Yeah,
So do something to fill your tank, and then you want to not let it go past a quarter tank. How you do
yeah,
your gas.
yeah, yeah,
Did you want
yeah.
to fill up? You do the
Right.
same thing.
Mm,
You watch, you take, okay, Sunday is my day. I'm gonna binge watch New Amsterdam.
right, right.
I got, y'all know how to do this and that.
Mm-hmm.
So and so gonna come over. You go into your play date.
Yeah.
Whatever. But you make that happen. Now, I do. So I'm an international best-selling author in a book that I am a part of,
Mm-hmm.
that is the parenting owner's handbook.
Oh,
And
nice.
so in that, and I'm doing a course and preparing some things for parents where you need to put yourself first. But
Yeah.
how do you do that? And so one of the things is bringing the kids up to where as they're do age appropriate things, give them responsibilities
Mm-hmm.
and things. You know how we hold all that.
Yes,
We'll be
ma'am.
making lunches and they ninth grade and stuff, us doing laundry, and they they 12 years old, and it's
I'm just
like,
gonna cover my face over here because the amount of things that I do there's some things they do, but there's other stuff that I'm just like,
hmm
and it's a pet peeve of mine, y'all. I'm gonna just say it. I
uh-huh.
think I've said it 18 million times on here. I hate the way my kids fold clothes. I know it's their clothes, but it is something about seeing things like folded in a weird way that's just like
Yeah,
it used to get to the point where I would like refold. Like I
yeah,
still do this. Oh, I would just like, don't worry about it, I'll do it. And sometimes my
right.
husband has to like just put the clothes in the kids' room and he'll be like, they're gonna do it, do not touch it. However they
hmm
fold it, that's it. And I'm like, but can't nobody find nothing because everything is inside out. But I just be like, you know what? You're right. Don't worry about it. I'm just, I'm gonna go on
Right.
over here. But
And so that's a good
yeah.
point. We
Mm,
got to let things go, as
mm-hmm.
we have to learn to let some things go. So if you can't stand to see it, make sure that the clothes go straight to the drawer, and you don't open that drawer and
Yeah.
see them clothes
Right.
folded improperly. So we have to learn to let some things go to make room for other
Mm.
things to come in.
That's so good. That is so good. And the crazy part
hmm
about it is that I said to my clients, I did it when I was working in leadership, eliminate and delegate, right? Like you
Yep,
can't do your job if you don't eliminate and delegate. And I
that's
think
right.
it's correct, like age appropriate things, because the other part is
Correct.
that even though I tell my kids when it comes to like certain things that's happening, I'm like, my goal is to raise productive young men in society, right? I need you to,
Right.
but if you don't know how to wash your clothes, then you're gonna be dropping your
Mhm.
clothes over here, and we ain't having that, right? I need you to
Right.
figure out how to learn how to wash dishes or mop the
Right.
floor. But those are the things that
Exactly.
because we wanted a certain type of way as parents and our household that we like,
hmm
I'm gonna do it. You don't clean the bathrooms right.
Right.
But we're not teaching them how
Right.
to do life without us, right? And so then it's like
Exactly.
yeah, so that definitely okay. You got me together like twice today. Sheesh.
Yes, and so in that you'll find it helps you find more time as
Mm-hmm.
they become from babies to more
Yeah.
independent individuals. You'll have more time in that.
Yeah.
But knowing that you don't need 4 hours, you can use 5 minutes. So you take that bathroom break, you take a couple extra minutes, right? Because this is your
Yeah.
priority time. You got to go.
Right. Yeah.
So put on your favorite jam, listen to 5 or 10 more minutes of that episode,
Mm-hmm.
deep breathe, do whatever you have to do to kind of help fill your tank, just those itty bitty bits.
Yeah.
And that's where I get into the environment as far as your mental health goes.
Mm-hmm.
What's going to bring you joy. If pink is your favorite color in your environment, do you see pink?
Yeah.
If not, you better get you some throw pillows
Right.
and get you some pink kitchen towels,
Right.
because it's these little subconscious things that can give
Mm-hmm.
you comfort and help you keep going.
Yeah.
But you want to leverage every resource you have,
Yeah.
optimize your health the best you can so that you can bring your best self forward. And then when those thoughts come, you know how to redirect them and say, no, the evidence is this,
Yeah.
the
Yeah.
facts are this.
Yeah.
So, I have clients that thought come, you stop it so it don't spiral and you
Yeah.
redirect that sucker somewhere else. No,
Right.
even if you don't have something that you say or a way to redirect it, you recognize it and you stop it so it doesn't spiral and stop you moving forward.
Yeah, what they say,
Excuse me.
fear stands for false evidence
False
appearing
evidence
real.
appearing real.
Right, yeah.
Yeah.
And those are like those moments where you have to when you're what do you call it? They like you take a moment, your what you see, what you taste, what you hear, what you
Your
smell,
senses. Hmm.
your five senses to be able to ground you and to be
Right.
present in the space that you're in. And you're
Right.
right, you can do that anywhere. You don't have to.
Anyway.
I learned in
Hmm.
this class I was taking, like rubbing your fingertips together, like really softly, like you can feel the ridges
Yeah.
in your fingertips. And don't ask me how. I mean, clearly person has done like research behind it, right? So it
Right.
works. I'm just gonna say that it
Right.
definitely, but it does focus you on the moment, for you to be
Yes.
able to just like get out your head, because that's a lot of what we're trying to
Yes.
do. We just need to get out our head and be present, be in the
Right.
moment. But with that being said, if you need help with that, right, this is why we
That's
have
right.
this platform, is to be able to put you all in connection with other businesses, entrepreneurs that are doing the things that you need. So if you on the West Coast in Washington State,
Hmm.
Nevada, you said Arizona too, right?
Yeah.
Arizona,
And
I
mhm.
need y'all to get connected with Dr. Tiffany Smith. Okay.
And I can offer consultations nationwide, and give you guidance,
So
just
wherever
not
you
be,
at, you can get a consultation. Okay. Cause she
yeah.
just said it.
Yeah.
She offers it nationwide. Okay. And now I'm about
Hmm.
to say nation. Never mind.
I'm on your side.
Right. Yes. Dr. Smith, can you tell the people how they connect with you? How can they get connected to your practice to get that consultation so they can learn more about just being better for themselves?
Yeah. Number one, follow me on Instagram. So I'm creating a love fest with Instagram. I'm liking how it's doing. So I'm
Yeah,
gonna be
it's
putting
getting
more things
better.
there. Yeah, so I'm putting things there. And so my handle is dr. Tiffany M. Smith. I use my middle initial M. So dr. period Tiffany M. Smith. Follow me there for all kinds of tips and what I'm doing. I'm always speaking and got things going on. So I'm there.
Yes.
Um, Another thing is I lost my thought, but I'm gonna tell you about my gift for your listeners is
Oh,
I have a
nice.
21-day love thyself journey.
Yes.
And so it's a private audio podcast. And every day it's going to give you an activity, some education and activity for you to do to deepen your own self love for yourself,
Mm, mm,
because that's where everything begins, right? The doubt is, again, you're questioning yourself.
yes.
So as you dig deeper and love yourself, see, with all that fastness and that fluctuation, you ain't loving you. I mean,
Yeah.
let's just be real.
That's
You're
me.
not,
Yeah, you're not.
you know. So we got to know how to love ourselves, and then we can learn those little minutes of love that
Yeah.
that I talked about.
Yes.
But taking that deeper step into you is going to help you be better in every aspect of your life. It's going to
Mm,
give you clarity. It's going to give you that mindfulness that you're speaking about.
yeah.
A lot of the patients in my practice, they come to me because actually it's like your friend. They're in this state where they're not aligned with themselves, right?
Mm-hmm.
And she won't pull the trigger,
Yeah.
so
Yeah.
then over time that develops into anxiety. Now
Yep.
you're nervous and
Mm-hmm.
depression. And that's when I said pills aren't always the answer. Sometimes you got to get back into you
Yeah.
and get your life where you feel you should be, because you've been choosing things that have not been serving you. So
Yes.
that's why we want to get into the self love and the 21-day love thyself. So you can get that by texting self love to 702-919-4249. So it's
I know
seven.
that's gonna be in the show notes. She gonna give it to me because somebody is
Yes.
doing the same thing I'm doing. 702.
702. 919-4249 and text self-love. And then you can start that journey.
Yeah, so y'all know that's going to be in the show notes. Going to put the website, her Instagram handle, all of that will be there for you all to connect with Dr. Tiffany. Dr. Tiffany, thank you so much for today. I promise you, out of it doesn't even matter because whoever listened to it, like she say this, and I promise I don't be swelling, but I know for a fact that the Lord knows when I need to speak to people, regardless of when the
That's right.
episodes air. It is confirmation on something that is currently happening with me that He is like,
Mm-hmm.
this right here is your show them who you are moment. Okay.
Uh-huh.
Every time
Uh-huh.
you do an interview, this is a show them who you are moment for myself of like,
Mm-hmm.
I've already called you. I've equipped you. These are the things. I'm just sending these little nuggets just to remind you, keep it moving, keep going. Don't
That's
quit on
right.
yourself. And so I am so grateful for you being here. Thank you so much for sharing. Thank you for what you're doing in the community to just really get people back to themselves and really give people alternative to using medication that again, this could be a whole nother episode. So I'm just gonna say
Yes.
thank you. That's what I'm gonna say that before. Say
You
thank
are
you.
so welcome, and I appreciate being here, sharing my message. I want everybody to live life more abundantly. The most
Yes.
know that it's out there for you and go get it.
Go get it. Okay, y'all. So next time, keep slaying this. See ya. As always, y'all, thank you for rocking with me. Again, if you enjoyed this podcast and you find it valuable, you enjoy this channel and you find it valuable, please consider donating by buying me a coffee. Your support will help me to create new content, get an official podcast studio, and ultimately reach more people. That's what we need. We need more people on this movement. Okay. If you're not already signed up to the newsletter, go to my website, www.slayingselfdoubt.com, and sign up for the Slayer Nation newsletter. That's where you'll get updates, where you'll get what's going on. You'll get the news first. You don't have to wait until I announce it or hear. Okay. And lastly, well, second to last, please make sure that you share this with at least 10 people. We are trying to reach 100,000 downloads this year, and every subscription, every share counts. So we need it. We need you to send it out to your peoples so they can help us hit our goal this year. Lastly, if you are not already following me on Instagram, you need to go on over there and follow me at Slaying Self Doubt. Until the next episode, see ya.